Hello and welcome to today's webinar on active signposting or care navigation. Just like to open by telling you a little bit about us. We're Enhanced Primary Care Limited. We were set up this year because we love primary care, and our mission is to make it as good as it possibly can be. We realise that it's really tough out there, and we openly admit that we don't have all the answers, but we'd love to work with as many people as possible to develop their solution to the current challenges that we all face. A little bit about myself. I'm managing partner at Rars Park Medical Centre, and I've been a practice manager for 8 years now. Started off my career in a walk-in or Darcy centre, then moved on to a rural dispensing practice, and now at Rars Park Medical Centre, which is a semi-urban practice. So a little bit about Rars Park. So we wanted to support our patients to find the best person to meet their needs. We had a crisis of capacity, so we had 20 to 30 people per day requesting urgent contact over and above our daily appointments, which added up to 2.5 hours of unscheduled care. We realised that this was totally unsustainable for our team, but also what our team were finding was that they had people sat in front of them who could have self-cared, and they could have helped over the telephone, or could have used any number of services that are set up in our community. We've also started adding in multidisciplinary team members such as our nurse practitioner, MSK practitioner, and our health coaches. It's really difficult for patients to decide who is the best person to meet their needs. So we were offered the active signposting training by NHS England and took this up, but found that just sending the team away on a half-day training really didn't cut the mustard. There needed to be a change process to support this, and this was what we did. So we used QI methodology and process to really make sure that the change was well thought out, well structured, and really stuck. And we started by developing a signposting mission statement. Why did we want to do signposting? What was it about for us? And for us, it was about finding out what was really going on for our patients and then finding the person to match their needs. So what we then did was we developed a process chart, and we process charted our current process, which was essentially booking a patient appointment, and then we created the process chart for our new system. There's two advantages to this. Not only do you get to visually see how the system works, but you also find the sort of points where people are going to encounter a problem. So with our process chart, we also identified a couple of areas where we actually didn't have the answer yet, but the process would still work well enough without those answers. The other great thing about a process chart is that it allows you to hold the team accountable. The process is clearly documented, and if people choose not to follow it, then you can show them how it should work. Now, we started at the onset of our process by consulting with our patient participation group. We felt it was really important to have them on side to explain what we were trying to achieve and really get their input on what it could mean for them as patients. And before we even started the process, we announced that it was coming. We felt that it was a good idea to give our wider patient group a heads up that things were about to change. The next step in our process was to decide what questions we were going to ask. And this is, based on the team that you have, and you have to be asking those questions for a reason. There's no point in asking the question if the person who's asking that question isn't able to do something with that information. We also decided at this time that we would build in an appointment audit. Although we'd done sort of spot demand and capacity audits and searches, actually this was a way of building in a constant capacity and demand audit. Following that, we needed to be able to create some searches, both for the signposting, so how effective is the signposting, and also that appointment audit. We created a data entry template. Now, we're EMIS web users, so we've created an EMIS web template that we can launch from the F12, and our receptionists do that on every single encounter with a patient. We created a phone message so that people are reassured that when they speak to our reception team, their information will be dealt with confidentiality. We also created a signposting protocol to support our team. Basically lays out a whole load of things that they may encounter and how they should signpost those patients appropriately. And then we set our go-live date. My question for you today is, why reinvent the wheel? We all already have enough to do. This might feel like something that you've been asked to do, or perhaps even told to do by NHS England, but it really can have a massive impact on your practice. Enhanced Primary Care Limited have created the basic implementation protocol, but also an implementation protocol plus, which includes detailed step-by-step guide to rolling out active signposting. We also do a product that includes our data entry templates if you are an EMIS web practice, or indeed we can offer an on-site visit to support your team to implement active signposting. So where is Riles Park Medical Centre now? So within 2 weeks we'd implemented the active signposting system, but using that quality improvement methodology, we've refined our system to include a chest pain protocol, mental health protocol, and UTI protocols. System's been well received by patients, less than 1% refused to answer the questions. And through active signposting, 33% of the patients who call in are offered a solution other than an appointment with the doctor, which of course leaves those appointments that are available with the doctor free for those patients who need to see a doctor. And those episodes of unscheduled care, they haven't gone away, but we are down to 5 to 10 per day, which is much more manageable. Now we have an exclusive offer for you today. It's available for 24 hours from now. That implementation protocol is yours for free for attending. Thank you very much. If you want to grab the Protocol Plus, we'd normally charge £99 for it. You're able to get that for £49. If you are an EMIS web practice, why not add the data templates in? That's now £99 instead of £149. And if you're thinking, oh my goodness, I don't have time to do any of this, then why not ask us to come and do an on-site visit? It's half a day, normally £899, but if you book within the next 24 hours, we can do that for £499. I'd like to thank you for watching. If you have any questions, don't hesitate to send me an email at daniel@enhancedprimarycare.co.uk. Thank you.